Here we have the model of the skin, also known as the integument. It's the largest organ in the body and has multiple functions. Skin is divided up into three layers: the epidermis, the dermis, and the hypodermis, also known as the subcutaneous layer. In the epidermis of the skin, you'll find stratified squamous epithelium keratinized, for protection. In the dermis, you predominantly have connective tissue, and all of the yellow tissue in the subcutaneous or hypodermis layer, or superficial fascia, is adipose, or fat tissue. The structures that you find running through the skin are your blood vessels, your capillaries, arterioles, and venules, and capillaries that go just short of the epidermal layer, because as you may remember, epidermis is made up of epithelium, which is avascular. So you have your blood vessels only in the dermal layer, which is connective tissue, which is vascular. Other structures that you have here are your sweat glands for excretion, your sweat duct leading to the sweat pore at the surface of the skin at the epidermis. Now realize that on one side you have three-dimensional views of the structures, and over here they're cut, so you're seeing sections of them. So here again you have a sweat gland with the sweat duct leading to the sweat pore. Over here you have a hair follicle, same thing over here. You can see the shaft of the hair coming up to the surface, and associated with that are the sebaceous glands, or the oil-producing glands of the skin. And over here you can see the sebaceous glands again. Both sebaceous and sweat glands are examples of exocrine glands because they have ducts that they're secreting through. Other structures that you have on here is the erector pili muscle, which makes you have the hairs stand on end or gives you goosebumps, which is innervated by the sympathetic nervous system. It's smooth muscle, the erector pili muscles. And as far as the sensory components of the skin go, we have various different things. We have deep in the subcutaneous layer your Pacinian corpuscle, or pressure receptor, that picks up deep touch sensations. You have your Meissner's corpuscles up here, which pick up tactile or light touch stimulation. We have free nerve endings over here that could be for pain perception or nociception. So that's the skin. Just to review it again, we have the epidermis, the dermis, and the subcutaneous layer with stratified squamous keratinized epithelium, connective tissue, and adipose tissue. You have the sebaceous glands for oil production and secretion, hair follicles, erector pili muscles, sweat for excretion, sweat duct, and the pore. And of course your blood vessels, the red and blue structures. And your nerve endings, you have your Pacinian or pressure corpuscle, you have your touch or tactile receptor or Meissner's corpuscles, and your free nerve endings.